Hello, 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 hello. Good evening, good evening, fellow friends and loved ones. Yes, it's once again a privilege and honor to come to your homes this evening as we talk about a very, very also important condition. Yes, our previous discussions has led us to talk about so many conditions, and I'm sure we've learned a lot, and then we are in a very good position to talk about the condition that we discussed in our previous times. Today is not an exception. We are trusting God that we will learn a lot from today's discussion, and today's discussion is titled Iliotibial Band Syndrome. Iliotibial Band Syndrome. That's today's discussion. The topic for today's discussion: Iliotibial Band Syndrome. Okay, so before we zoom into what we're going to talk about today, we're going to look at our outline. Yes, our outline for today. We're going to look at the short quotes, and then we're going to talk about the definition or the description, the clinical relevant anatomy. We're going to talk about the epidemiology, that is what causes it. We're going to talk about some characteristics of the condition, and then how it presents itself, and then some differential diagnosis, that what other conditions look like this condition, which we need to watch as clinicians to be able to differentiate between the two. We're going to talk about some diagnostic procedures, that is how are we able to identify this condition as iliotibial band syndrome, the diagnostic procedures. And also we're going to talk about some outcome measures. How can we be able to monitor improvements with this condition? What do we do? And then some examination, and then some medical management by the medical doctor, and then physical therapy management by the physiotherapist, then some likely surgical management of the condition. Then we'll wrap up with some lifestyle modifications. So what can we do to prevent this condition from becoming worsened? Okay, so we are zooming into today's discussion. Okay, so the quote for today is: whatever you intend to do, do it with all your might, with all your strength. And then the law of ripple effect will have its course. So whatever you have to do, do with all your mind, with all your strength, and the law of ripple effect will have its way in you. Okay, so that's the quote for today, the food for thought for today. So what is iliotibial band syndrome? That is ITBS. So what is it? And so some of the other names that can be identified with this ITBS, we could have IT band syndrome, we could have ITB syndrome, we could have also ITB friction syndrome. So these are some of the names that we could identify this condition. So this condition actually, it's something that affects a particular part of the body, and that is just away from the knee. So when you have your knee just at the side of the knee, we have a structure there that we call iliotibial band. Iliotibial band. Iliotibial band there are two words. Iliotibial means there's a part of the structure in your around the waist region called the ilium, and then around your knee there's a part of the part of your leg called the tibia. So there's a structure that runs from your hip region to your knee, and that structure is called the iliotibial band, and that protects us from raising our leg sideways. So if you're able to lie on your side and you raise your leg up and down, and then you don't have any pain, you don't have any stiffness, it means that that structure is very strong. But in the case where you lie on your side and you raise your leg up and down, and that structure, you can't be raise it up. You can't raise the leg up, or you feel pain when you're raising the leg up. It means that causes for a caution to see whether that structure has been affected. If it has been affected, you can have the condition we call today, that's our discussion today, as iliotibial band syndrome. Okay, so actually this condition is not a traumatic condition. That is, most people don't get it at once. So it's as a result of continuously working, mostly involving running. So those who run a lot, that is athletes who run long distance, they're likely to have that structure being worn out. That is, they lose their strength, and then they can have this condition as iliotibial band syndrome. So actually this condition is seen when a person tries to squat and goes down to about 30 degrees. So on bending to about 60 to 90 degrees, the person or the patient complains of pain at the outside part of the knee. So as we go on, we look at some of the pictures to be able to identify what I'm talking about. Okay, so when the person bends about 60 to 90 degrees, the person complains of pain around the outer part of the knee, and the person could have iliotibial band syndrome. Okay, so some of the clinical relevant anatomy, that is the structure itself. So what are the things that surround the knee? So let's look at some of the pictures that shows how the knee looks like and what the iliotibial band is. I'm sure many people are asking, or many of us are asking, so what am I talking about? Iliotibial band. It is a structure in our body. Yes, so let's look at it. For today, I'm sure we'll have a better understanding of this structure. It's quite a small structure, a thin structure, but I'm sure we'll appreciate it more when we see it. It's quite a thin structure. Okay, so I think we are having it here now. Okay, so let's all look at it. Okay, so just a minute. Okay, so yes, so as we said, this is the iliotibial band structure. So let's look at it. Let's look at the increase the lighting so you can see it all. So this is the iliotibial band. Yes, so you can see it here. Yeah, so this is this whitish thing. It runs from here. So around this place we have the ilium. It runs right out to this point here called the tibia. The tibia bone, that's the leg bone. So it runs from here right here. So this whole structure is called the iliotibial band. So as you are running, it's supposed to prevent you from falling sideways. It's a very strong structure so that you can run forward. If this structure is not so strong, I don't think you can run straight. As you are running, you'll be shifting to your right, you'll be moving to your right side more. Okay, or if it's your left side, be shifting your left side more if it's weak. Okay, so this is the iliotibial band. So I'm sure we can now appreciate it. Okay, so I'm sure we can appreciate it the more. Yes, so that's the iliotibial band. That's the iliotibial band. Let's look at some more pictures before we continue. So this is the iliotibial band. This white thing is called the iliotibial band. So at the point where there's injury to that structure here, you can see the redness here. It means there's either a tear or a trauma to that side, or someone who has been running for a long time. This could present itself to be pain, or even sometimes some small tears, micro tears. Okay, so this is also, as we discussed, it's a very thin structure. You can see it here. It runs from this structure. This bone is called the ilium. We have that forms our hip. We have two bones at the hip region called the ilium. So this ilium, and the whole structure, that's the iliotibial band, runs from here, from the ilium, that is the hip region, right down into the leg, so the lower leg, and then attaches it to the tibia bone. So they've shortened it to form iliotibia, but the real thing is ilium tibial band. So it's a long structure here. Okay, so when there's injury here, it can cause iliotibial band pain or iliotibial band syndrome. Okay, so let's look at some small pictures. Okay, so this is very clear. We can see it clearly here. And then let's look at if we have other more. Okay, so yeah, so this is the very good picture of the iliotibial band. So you can see the long structure here. We have other supporting structures. We call this is gluteus medius. So it's also part of the structure that supports the iliotibial band. We have the gluteus maximus, that is our buttocks, and then we have other structures behind called the biceps femoris, and then we have rectus femoris in front of your thigh, iliotibial band tract. So many structures that all help to support the leg. Okay, so this is just a summary of the iliotibial band and how it looks like. Okay, so you can see here this yellow structure here, it runs down there. Okay, this is very visible. Another one too. Okay. So the last one before we continue our discussion. Okay, so that is it. Okay, so we continue our discussion. Yes, so I'm sure you've seen so many pictures depicting the or showing the iliotibial band, and I'm sure we have a very good memory of it. And so we continue our discussion. So this is the anatomy of the condition. Therefore, we now go on to the epidemiology. When we say epidemiology, we talk about the causes. So how does it come about? So in this case, the iliotibial band comes about by mainly overuse injury. That is when you do an activity repeatedly. So that is if you walk a lot, or mostly it's for runners. Those who run a lot are likely to be predisposed to this condition because the band is a very strong structure, so it demands you having high impact on that structure, that is the band, to be able to cause injury to that side. It doesn't occur just like that. So mostly runners are likely, they are more likely to be affected by this condition. Okay, so research said that people who complain of knee pain, 5% to 14% of them are likely to have this condition called iliotibial band syndrome. 5 to 14% of people are likely to have this condition called iliotibial band syndrome. And those who complain of leg pain, 22% of them, those who come to hospital to complain of you having leg pain, my knee pain, my foot pain, my thigh pain, most of them have this condition called iliotibial band syndrome, together with the other similar conditions. Okay, so as we said, people who are affected are mainly runners. Yes, mainly runners, and then long distance runners to be specific. And so they are likely to have this condition. The structure that is where the band is attached at the lower leg is called the lateral femoral condyle. Okay, so lateral femoral condyle. Okay, so it's very important that we're able to appreciate the fact that the attachments are very, very, very important to be able to diagnose this condition. Yes. Okay, yes. So to be able to diagnose this condition, and I'm very, 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 very emphatic about the fact that we should note, in case we have this pain around the outer part of the knee, that's the side of the knee away from the inner part, be able to recognize and report as early as possible, because your whole body is bent on your leg. So if you have anything that is going to hinder you from walking and then coming out to the activities, you need to really come to see the various or the specific medical personnel, specific the medical doctor or the physiotherapist, to be able to treat this condition. Okay, so mostly this condition presents with so many presentations. Yes, so we have pain, we have tightness, we have stiffness, we have difficulty in performing activities like probably standing on your leg. There's difficulty doing that, and then we advise that when you notice such presentations, we report as early as possible. So we noticed that in the initial presentation, that's the earlier discussion, we said that when you bend your knee to a particular angle that is about 60 to 90 degrees, you feel the pain. So when you do that and then we observe that there is pain, then we can be able to give you the necessary and appropriate treatment as early as possible. So Now, looking back to history, how this condition came about, there was a man called Lieutenant Commander James Wren. Yes, he and other people, they were the medical professionals, and then they able to discover this through various military recruits that they came into contact with. So as they're recruiting soldiers, some of the training that they went through, they realized that no, when they asked the new recruits to bend their knee, that is stand on one leg, and try and squat. So we have something we call single leg squat, that is standing on your leg and squatting, standing on one leg and squatting. Those people couldn't do that, and they were complaining of pain and then difficulty doing it, and so this resulted in the discovery of this condition called Iliotibial Band syndrome. Okay, so other researches followed on till this time, where we have various improved versions, that is tests to be able to diagnose this condition. Okay, so we've seen some of the history and then some of the causes. Also, we're going to look at some differential diagnosis, that is other conditions that could look like this particular condition called iliotibial band. Okay, we have some conditions like bicep femoris tendinopathy. I know they are very big words, but just to refresh your mind that there are other conditions that look like this condition. You have degenerative joint disease such as osteoarthritis. So you can have osteoarthritis in the knee, and this could present pain, but it won't be at the side, that is the outside part of the knee. It won't be there. When it's around the inner part of the knee, that's the joint area, then it could be degenerative joint disease. But aside that, it's not. So when we note that it's not there, then we zoom into the iliotibial band syndrome and then check on it. Other conditions such as meniscal dysfunction or injury, myofascial injury, patellofemoral stress syndrome, so many conditions in the knee, and then we need to be able to, as medical professionals, give the specific test or conduct the specific test to be able to diagnose this condition. Okay, so how will we be able to see that this is a condition or this part of the body is affected? So we have various tests as physical therapists to be able to diagnose this condition. We have three main specific tests, and we have one Renes test, we have the Nobel's compression test, and we have the last one, Ober's test. There are so many tests that we could do as physical therapists, but the three main tests are also very, very crucial. The first one, that is the Renes test. You're going to lie on your side, and then you're going to bend we call it extension. That is, when you lie on your side, you push your leg backwards, that's your hip backwards, you push your hip back as if you are kicking someone backwards, and then you open your legs upwards. So as you are pushing your leg backwards, that is your hip backwards, you raise your leg also back upwards. So as you are doing that, you do it at a particular point in time, and then the physical therapist holds the inner part of your leg and tells you to drop your leg slowly. So at the point where your leg is at a same distance as your body, that is horizontal, there's a point where you are able to control yourself, that is hold your leg that is not on the bed in place, and then you don't complain of pain. Even when you drop a little, you don't complain of pain. But the moment where as your leg is dropping, you complain of pain, or even your leg doesn't drop to the horizontal point and there's tightness around the lower part of your thigh, it could present itself as iliotibial band syndrome. And this is very, very important that we take note of it. As we also go on, we look at it again. At those who just joined, we're talking about the condition called iliotibial band syndrome, and I'm sure we are enjoying the discussion. So the second test is called the Nobel's compression test. They work together. That is the iliotibial band. The Renes test and then the Nobel test. They have worked together hand in hand to be able to diagnose this condition called iliotibial band syndrome. Other tests include the Ober's test. So they indicate tightness around the lower part of the thigh, getting to the the leg, that is the outer part of the leg, and then we can see the person or the individual has iliotibial band syndrome. Okay, aside our various physical tests, we also have various tests. So you can have an MRI. An X-ray cannot detect an iliotibial band syndrome because an X-ray can only go through a bone. You can't see whether there's a tear or there's an injury there. So you can go in for probably a CT scan or an MRI that shows a very detailed structure of the leg. Okay, so these are some of the diagnosis procedures that we can use, and also we look at some outcome measures where we can apply our experience to be able to get into identification of a structure called the iliotibial band. Then we treat the condition accordingly. Okay, so when you talk about outcome measures, there are various, we say, questionnaires or various standard measures that we can be able to use to monitor the level of improvement as and when treatment is done at the clinic or the hospital. So as physiotherapists, we have two outcome measures that we incorporate to be able to help to monitor the improvement of the condition. We have the first one is the lower extremity functional scale. So as exercises are going on, as pain relieving processes are going on, we go through the lower extremity functional scale to assess the level of improvement of the condition. And then we also have the numeric rating scale, that is the level of pain that the person is complaining of. So if the patient comes with a pain of 10, so the next time after therapy, the next week or the next session, if the patient complains of pain going to 8, we could see that there is an improvement. Or if it's still 10, then we have to also restructure our exercise protocols to be able to ensure that the pain is relieved in the better or in a positive manner. Okay, so aside the outcome measures, we also have various tests that we do. I've mentioned them. The OBES test, we have the Nobel's compression test, and we have the Renner's test. Okay, so after all these things, and then we noted that this is the part of the body that is affected, now we go into treatment of the condition. So treatment, how do you treat this condition? So first of all, if the patient complains of severe pain, as we've been discussing in our previous presentation, the first thing to do is to apply the principle of RICE, R-I-C-E. You rest the side, no activity or very limited activity. Then you go to ICE. The first 3 weeks, the very important thing to do is to ICE the particular side. So just like in the olden days, when we were children and then our head hits the wall, we have our head swollen a little. Our mothers don't go to prepare hot water, but they get ice block and then rub it around the side. The first week or first 3 weeks, icing is very important. So you ice the outer part of the leg, ice and ice and ice as often as possible, and this is very likely to relieve the pain. Then after that, you compress that side. Compression means you can bandage that side. So if it's your knee that is the affected part, you bandage your knee as firm as possible, maybe not tight, but as firm as possible. Then as often as possible, you elevate your knee to allow blood flow, because the tendency of the leg to get swollen is very high, because the body is preventing itself from causing pain to that side. Okay, so after applying the RICE principle, that is rest, ice, compress by using bandage, and elevate, then we will see improvement in terms of the pain. Then as the pain goes down, then we go through various exercises to strengthen that side. So for athletes who have this condition, they stop them from engaging in activity for a while, maybe a month or 2 months or 3 months, to regain their strength. Other than that, when there is re-injury or continuous injury, it could be worse. It could be total tear, and this could even destroy the athlete's career or the footballer's career or the sports person's career. So it's very important in terms of especially the long distance runners. Okay, so we've seen the what we do as physical therapists, that's using. So if the first 3 weeks we use ice, so after 3 weeks going on, we get hot water bottle, or we call something in the physical therapy unit hot pack. We put at that side to be able to relieve the pain so that the person can perform activity or the exercises very well. In the absence of this, when the pain is so severe that the patient cannot control, we take in medication such as paracetamol, you could take in tramadol, you could take in ibuprofen, and then other pain relief we have so many like Lofnac, other pain relieving gels also. Okay, so aside the medical management, the exercises that we do will be shown to us very soon. We have single leg squats, we have stretches, and then we have also squats. So these are some of the exercises that we do. So we'll see some of the pictures very soon. Also then, in the absence of no pain relief and then very intense difficulty in terms of movement or carrying activities, we now resort to surgical management. That is, the surgeon is called into place to see if there's severe tear where there's restricted movement. So then the surgery is carried out to be able to restore the strength in the leg, that's the outer part of the knee, that's the lateral side. So then after surgery, we return to physical therapy to retain strength, that is maximal strength, and then return to activity. Okay, so now if you look at it, what are some of the lifestyle modifications that we can do? So that is, what can we do to prevent these conditions from recurring? So first of all, those who are mainly affected are athletes, that is runners. So there's a protocol in physiotherapy, that is exercise therapy, that we need to do warm-up exercises. So every athlete is supposed to do warm-up exercises to be able to ensure there's effective blood flow before the athlete does a high impact activity, that is enduring activity, and then this will prevent the tendency of the structure called the iliotibial band to be injured. Okay, aside that, as normal as we are, as those who are not athletes who go to work continuously or daily, we also need to ensure that we walk not long distance, but be able to moderate the length of walks that we do. Walking is good, but doing it continuously also has its own side effects. So we have to be able to balance our activities. Though we don't have the tendency to be affected by this condition. In the latter end, as we also go, we are likely to have it because it's an overuse injury. So as we age, we have the tendency to be affected with this condition called iliotibial band syndrome. Okay, so let's note very important signs of this condition. So we have pain at the outer part of, that's the side of the knee, and then we also have the likelihood of palpation or palpatory crepitus. So crepitus means when we bend the knee, we hear some unusual sounds in the knee, and then there's likelihood that you can hear snapping sound. That is, you hear as you bend your knee, you hear and these are signs that show that there's a likely injury to that part of the knee called the iliotibial band. Okay, so this is the exercises and then the various subtopics that we can talk about in the iliotibial band syndrome. We've talked about the definition, the clinical anatomy, the causes, the characteristics, how they present themselves, and then how to treat them in various examination and test procedures. So let's look at some of the pictures of the condition. Let's look at it. It's a random picture. I'm not selecting it in order. So let's look at some of the pictures. Okay, so I'm sure we can see the band itself. Those who were not around before we started, so this is the iliotibial band. This thing, this long stretch, this whitest thing, it goes down to your knee, and it crosses your knee to your leg, the lower leg, called the tibia. So from the hip bone called the ilium down to your leg, lower leg, called the tibia. So it's called iliotibial, ilium and tibia, iliotibial band syndrome. That is the condition. So when you have this condition, the physical therapist or the medical doctor could give you this structure. It's called a brace, an iliotibial brace, to be able to hold the knee and prevent pain in that structure. Okay, so these are some of the anatomy that is where it's affected. So it's around this side. So mainly the iliotibial band syndrome is affected around this side. So around this side. You can see where the reddish mark is located. Okay, so this is another one, a very good presentation of the condition. So the size of the pain, you can see written the size of the pain. Okay, so we look at, this is very, very, very clear. I'm sure we can appreciate it. This is the iliotibial band, the whitish structure is called the iliotibial band. It is composed of a structure we call the tensor fasciae latae. It's a very important structure to hold the leg in place as when you're lying on your side, to be able to raise the leg up and down. Okay, so this is a very good anatomy. So the bone here is called the femur, and the bone here is called the tibia. Beside this is called the fibula. So the connection is between the tibia and the femur and goes up into the hip bone. So we can see it here very, very vividly. So this is anatomy, a basic anatomy of this condition. Okay, so when we note that the pain is also intense, we can do something we call taping. It's kinetic taping. In physical therapy, we have something called kinetic taping. That's, you apply some tape around the structure here, along and then across, to be able to improve the pain level, that is to reduce the pain, and then also to relieve any stiffness around the structure. And then the likelihood of swelling around the structure could be resolved with the use of the taping. So anatomy, very good anatomy of the condition. So you can see the pain around the side. So this is the iliotibial band, this is the pelvis, that's the hip bone, the gluteal muscles. Then the one behind the leg is called the gastrocnemius, that's your leg bone. Okay, so let's look at more pictures. Okay, so you can see it here. Okay, this is another anatomy. Okay, so you can see the iliotibial band, very thin structure, and this structure is called the tensor fasciae latae. So this the muscle here attaches to the iliotibial band and goes down to the leg bone. So this controls you from falling sideways. It's very important structure. If you're not so strong, you're likely to fall sideways with very little force. Okay, so this is a very good example. You can see the picture here very clearly, the tensor fasciae latae and then the iliotibial band. So the connection is from the tensor fasciae latae muscle to the iliotibial band. So it goes away, and then the iliotibial band ends here, and so that's where the pain is. Okay, so when you notice pain around your knee region, so this is your knee. If you notice the pain just beside the knee region and it's very sharp and then painful, you just know that you have this condition, iliotibial band syndrome, and you need to report to the physiotherapist as early as possible, or the medical doctor who will refer to the physiotherapist. Okay, and this is also another one, anatomy. So we are seeing, so when you go to the physiotherapist, you're going to carry out this test. So the patient will be told to raise the leg up, and they're going to push the leg down, and then if there's pain there, we start treatment as early as possible. Okay, so this is another picture of the iliotibial band, very, very clear. And then also another one, so you can, I'm sure you won't forget it after today. So this is also the iliotibial band syndrome. So you have pain around the side. So the pain is mainly here. But if you have the pain around the side, it's also another condition called the runner's knee pain. We're not talking about that one today. We're talking about the iliotibial band syndrome. That is at the side of the knee, the outer part of the knee. Okay, so this is another one, iliotibial band. Okay, another one. So we go to exercises such as this. We have something we call the TheraBand. So it's a band that doesn't tear. So it's very strong and then very resilient. That is, it can be able to withstand stress. Okay, so the patient ties around the leg, mainly because the patient is young. An old person is very likely unable to do this. So the patient ties the band around the leg, both legs, and then opens up. So as he's doing that, it's strengthening the iliotibial band. So the iliotibial band is located around the side, and then helps to relieve the pain and strengthen the side. So we have also other stretches. So we have these various stretches. So you cross the leg. So the left leg has gone forward, and then the right leg is behind. So as he's doing that, it stretches the iliotibial band here and helps to relieve the pain. So you can repeat it probably 4 times, and then you rest. You can do it 3 times a day. So this is the iliotibial band. Okay, another one. So another one, that's the iliotibial band. That is it here. Okay, another one. So we can see that mainly people who do weightlifting also can be affected. So they go down beyond their limit, and then they could have iliotibial band syndrome. So weightlifters, if you have someone who does weightlifting, you also have to make sure that you advise him to put on the very important accessories, that is knee supports and other things, to be able to hold the leg and the knee in place to avoid having this condition called iliotibial band syndrome. Okay, so this is a very good presentation to look at where it is. The iliotibial band is located here, and this is the injured part. Okay, all right, so these are more pictures. So aside that, let's look at finally some exercises that we can do. Okay, so let's look at the exercises now. So these are some of the exercises. So we can put a roll on the ground and stretch, so it goes down and backwards, so it helps to relieve any tension or any stiffness around the structure. It's near the iliotibial band. Okay, and so first exercise, you can do some stretch. So you go down and up, you bend down and up. So this is, you bend down and up. You also can lean against the wall by stretching your hands forward, and then you open your legs up and down, or you can lie on your side as we can see here, and then raise your leg up and down. You also can tie a band in front, and then you put your leg inside, and then you raise your leg backwards. You push your leg backwards, as you can see in the picture here. You also can do some forward stretches. So we can see the lady bringing your leg forward and stretching. Also, we can lie on your back and then raise your leg straight onto a wall, and then also helps. And also we can also do standing and then trying to bend your knee backwards and then holding for some time. You also can lean against the wall and do some going down a little, but in this case you have to also limit the distance at which you go down. Okay, so these are some of the exercises that we can do. So similar exercises that we can see here. Yes, so these are some of the exercises. I'm sure we can see them very clearly, very clearly. Yes. Okay, so this is a person complaining of pain. This is an athlete, a strong man. Okay, the similar picture. Okay, some of the stretches. Okay, so this is some of the exercises that the lady is doing some stretches to strengthen the part of the leg. Okay, so we talked about the iliotibial band brace. Okay, and this is the icing. So you can see the person is doing a lot of icing around the outer part of the knee. So it's very important. And the first point of pain, the first time of pain, so the athlete is returning back to injury. So you can see the brace here and do some exercises at the beach. Okay, some of the exercises. Okay, so you can do some step up exercises as the lady is doing there. So you go down and up, down and up. This is the points where there's no pain, but there's likely some weakness around the outer part of the knee. So this helps to strengthen the leg. Okay, so you can see the physical therapist assessing the old man there. Okay, all right. So some of the exercises that we can see here, we talked about some of them earlier on, so let's appreciate it. Okay, so these are some of the bands, the protective devices. Okay. So you can see the physical therapist, the lady teaching the man how to do some exercises, like squatting and limiting the movement down. Okay, So. It's been a wonderful time. I'm sure we've learned a lot. Yes. Myself, I've also learned a lot. Yes, I've learned a lot. And please, if you have any questions, all questions are welcomed at this moment, at this opportune time for all of us to learn a lot. If you have any question pertaining to this discussion, your questions are welcome. Or any other question? Any other question? Yeah, any other question? We'll be expecting you. Any question, please? Any question? So we talked about iliotibial band syndrome. Okay, so any question? Some few seconds. If you have any question, yeah, all questions are welcome. Yeah. Any question? I know we are typing the question. Yes. Okay. Any question, please? Okay. So yes, who is affected most? So I talked about the fact that people who run long distance are affected most. Yes, so if you are a long distance runner, you are likely to have this condition called iliotibial band syndrome, and it's also called an overuse injury. So as you age in, if you involve in activities that involves walking long distance, you are likely to have it. It doesn't mean that it's a concrete that you will have it. No, there are other modifications that are taking care of yourself also that prevents you from having this condition. Okay, so we talked about iliotibial band syndrome. Any last question again? Last question. Okay, I trust that we've learned a lot. Myself, I've learned a lot from this discussion. Okay. All right. So is there a question? Okay, no. In the absence of any further questions, if you have any question, you can mail me. You can text to number 0540514092, 0540514092. You can mail us with any suggestions, any comments, any how do you call it? Any suggestions. Yes, if you have any contributions also, you are welcome. So the foundation, RICOY Health International Foundation, sponsoring this presentation, and we hope that you join us in our next presentation and then share the link, yes, so that we all can benefit from this presentation. I'm very glad for your time. May the Lord be with us all. Today is the 6th of December 2020, and then next week by this time we'll have our next presentation. And so the next topic for our discussion is titled chronic bronchitis. So let's stay tuned and then let's wait for next week's discussion. And I'm sure we'll also learn a lot from this presentation. Thank you very much for your time. May the Lord be with us all. Have a blessed week. May the Lord guide and protect us and keep us safe. Tomorrow is a very important day. A decider for the country, the nation Ghana, and I'm sure that we are all glued. I'm sure some of us are not even sleeping till tomorrow morning till like 5 o'clock. We'll be going to our voting centers. We ensure that we all take care of ourselves. We don't engage in any vices. If someone worries you or tempts you or crosses you even to go and vote, crosses you, just allow patience to have his way. Allow the person to go and go and vote. Your turn will come. You won't stay there till 5 o'clock. So let's all go and vote, and the Lord will install his own leader. And the Lord be with us all. Have a blessed week. Take care. Bye-bye. Take care. See you.